businesses that are, that have between 2 and 9 employees also offers an option to help cut the cost both to the employer and potentially to the employee. And then for larger businesses, there's hope that maybe healthcare reform can, assist those. I agree that affordable healthcare is one of the largest obstacles that people face in going to the doctor. And I think it's important, and I think the state has made tremendous strides, as Delegate Morheim and Vinnie DeMarco have mentioned, in providing affordable coverage. And I think the Health Insurance Partnership is one of those key ways that they've done that.
So let's take a minute, just a minute, and explain what the Maryland Healthcare Commission Small Business Partnership Package is all about. 2 to 9 employees.
So if you are a small business with between 2 and 9 employees and you have an average wage which is below $50,000,
I think that would fit a lot of business owners I know.
yeah, you can contact your insurance broker and work with them to not only there's a number of plans that are offered, a number of insurance carriers that are offered through the partnership. So you choose a carrier and a plan, and then you do a subsidy calculation with the assistance possibly of your broker, and you apply, and this public-private partnership will help cover some of those costs. Depending on the average wage of your employees, it can cover up to 50% of the health insurance costs.
So, what type of things are needed in one's application? Tax returns?
There is information regarding the adjusted gross income of your employees, as well as whether they want to have their dependents covered and so forth. The application is fairly easy to complete. It's on our website, mhcc.maryland.gov/partnership. You can find an application there. And again, your insurance broker can also assist you in completing an application.
How would you say, one last question, how would you say the state of Maryland is coming along? Here we have Vinnie DeMarco bragging on this current governor. He said or suggested that the last governor was adamantly opposed to health care coverage for all Marylanders. What saith you?
Well, I think that the Working Families and Small Business Health Coverage Act is a great stride forward for the state of Maryland. I think it brings it into the 21st century, and I think, by focusing on small businesses, it makes Maryland unique in focusing on a prime population, a prime part of our economy that often needs help with health care.
Okay, someone on the line wanted to interject.